for a tattooing in a tattooing center, when you don't take blood in a good blood bank, you can have these infections. We have different types of hepatitis viruses. Of them, hepatitis A and hepatitis E are grouped as an entity. Hepatitis B and hepatitis C are grouped as an entity. So based on the modes of transmission, we have divided these two. Hepatitis A and hepatitis E are transmitted by orofecal transmission. That means we get these infections when we eat or drink contaminated food and water. So hepatitis A and E are most common hepatitis viruses or infections what we see. They are mostly seen in young people, children and adolescents. So it is always because of contaminated food and water. Hepatitis B and hepatitis C are grouped in a separate category. These viruses are transmitted by parental route. Parental route is nothing but blood to blood transmission. Whenever there is a contact of blood from an infected person, you get this infection. For example, when we are using contaminated or unsterilized needles, it can be for an injection purpose in an hospital, it can be for a tattooing in a tattooing center, or this can be transmitted by contaminated blood products. When you don't take blood in a good blood bank, you can have these infections. A blade or a razor which is not sterilized, you may get this infection from some other people. So there are different modes of transmission, and the most important mode I would mention here, mother to child transmission during pregnancy or childbirth. So hepatitis B and hepatitis C are transmitted parentally, and these are all the modes of transmission. Thank you.